Hi, this is Dr. Chan here at Crown Dentistry. Today we'll be answering some questions about Invisalign clear aligners. So Invisalign clear aligners are basically the newest phase of orthodontics. Orthodontics, of course, is just moving teeth into different positions. A lot of times it's for aesthetic reasons, sometimes it's for functional reasons as well. I would say still most people do orthodontics for aesthetics, right? They want to get a nicer smile, or they don't like how their teeth are situated, so they want them to be straighter or more uniform or in a different position. But Invisalign clear aligners helps us to accomplish that. Traditionally, orthodontics was done with brackets and wires, right? They put those little metal buttons on your teeth, they glue them to your teeth, and then connect them with some sort of metal wire. With the advancement of clear aligner technology, we can now accomplish the same thing without the brackets and wires, and instead we use clear plastic trays. Invisalign treatment times will vary depending on a patient's current tooth position. Obviously, some people have more movement that needs to be done, right? Some people's teeth are more crooked, some people have more spaces. Maybe there's some teeth that either need to be removed or reshaped in order to allow the teeth that you do want to keep to move to the positions that you want to have them in. So the treatment time changes. We've done it in as short as about 6 months for people. Sometimes it takes a couple years, especially if people have, for example, bites that are maybe less than ideal. And we're trying to shift a whole bunch of teeth or reposition the jaws relative to each other, right? The top and the bottoms need to be in a different position relative to one another. So that takes some time. Sometimes more parts are needed. Sometimes we need to bring in elastic rubber bands to shift the jaw one way or the other. All of these things, it's just part of the treatment, but it does add treatment time. So like I said, it can go up to a couple of years in terms of treatment time. And like I said, a lot of things will be a factor in how long the treatment takes. Obviously, current jaw position and just the patient's own tooth position and everything about their mouth. Honestly, a big part of influencing how long treatment takes is how diligent and conscientious patients are in terms of sticking to the treatment. Because aligner technology is not fixed in your mouth, right? You can remove it. Actually, you have to remove it for brushing and for eating. Some people are more conscientious and diligent about wearing the trays for the time that we recommend. And if patients if they don't follow the recommendations as closely, then unfortunately it will add to the treatment time. So for most people, we have people wear one set of trays per week. So pretty much you're going to wear the same trays for 1 week, and then after a week you change to the next set of trays. The way that we usually do it is I usually give our patients 4 to 6 sets of trays at one time, and then they just change it out. And then after that 4 to 6 week or 4 to 6 tray period, we check things again, and then we'll give them the next set of trays. Some patients need more than a week, especially if the teeth are being a little stubborn and they aren't quite moving as quickly as we want. Sometimes patients need to sit in the tray for up to 2 weeks, and that's totally fine. Of course, it does lengthen the treatment time. So one of the most beneficial things about Invisalign versus traditional braces is that it's much more aesthetic. With traditional braces, you can see the metal brackets on your teeth, you can see the wires, and a lot of times people don't like the look of that. Also, a lot of times the brackets and wires can be traumatizing to the inside of your mouth, right? It'll cut up your lips and your tongue. Sometimes your cheek can get caught on the brackets and it can cause a cut or a tear. With Invisalign, you don't have to worry about that. the clear plastic trays are smooth and there's usually minimal trauma to the inside of your mouth. Also, you can remove it. The good thing is that if you really need to, say for example, go to an event or do something where you just can't be bothered to have things in your mouth, you can remove them just for the night or for the day and then go do what you need to do and then come back home and then put your trays back in and then you can just continue on with treatment. So there's a lot more flexibility with Invisalign versus traditional orthodontics. So one of the main things that influences the price of treatment is whether or not there's insurance help or not. Also, people need to check and see if their insurance actually covers orthodontics. Usually most insurance companies will have an orthodontic allotment that's sort of a maximum for the life of the patient. So they'll usually give the patient a certain amount of money and that will apply towards the cost of treatment. Cost of treatment generally runs anywhere between $5,500 to $6,500 in this current climate. And like I said, it depends a lot on your individual insurance coverage in terms of exactly where you'll fall on that. If you do have insurance coverage, usually it's more towards the lower end of that range, and cash patients, a lot of times they'll be more towards the higher end of that range. Everybody has a different image of what they're trying to accomplish with their Invisalign. Usually people want straight teeth, they want teeth where there's no gaps, and so I think it's important to look at what's realistically possible with you as a patient, your specific mouth situation. Sometimes people have bites and they have teeth positions that there's limitations, like you can only do so much with the teeth as they are, and sometimes people might want to have a certain appearance or look to their smile, and maybe Invisalign can get them part of the way there. But for example, maybe if more improvements are needed in terms of tooth shape, tooth size, tooth color, other treatment modalities might be needed. For example, we might need to whiten your teeth. We might need to add either fillings or crowns in addition to the Invisalign. In extreme cases, sometimes jaw surgery or oral surgery is needed in order to reposition the jaw. And I'm not saying that people will need necessarily any or all of these treatments, but sometimes potentially we do use all of these other kinds of treatment in conjunction with the Invisalign treatment in order to get you the smile that you want. So the way that Invisalign works is that we work with the Invisalign lab to basically make these clear plastic trays that fit around your teeth. And these clear plastic trays, they fit around your teeth, but they're actually slightly different in shape. They're a little bit closer to where we're trying to move your teeth, whether it's up, down, left, right, or trying to rotate them. So the trays, they fit very snugly, but they're actually a little bit tight in certain areas because that means that we're trying to move those teeth into a position that's different from the way they are now. And sometimes in order to help with the movement of the teeth, we'll put little tooth colored buttons on the teeth. And these are made of plastic. They're tooth colored, so they're really difficult to see. They pretty much blend in with your teeth. It's actually the same kind of material that we use for tooth colored fillings if you have a cavity or something like that. So we will put these little buttons on the teeth, and these buttons will help the clear plastic trays actually grab your teeth more efficiently and move them into the positions that we want them to be moved to. So the best way to see if you're a good candidate for Invisalign is to just give our office a call and talk to me or talk to our staff. And everybody here has a really good understanding of Invisalign, and so they can answer any questions you might have on whether or not you were a good candidate. You'll probably have to take some pictures, some x-rays, do an exam, but that's all part of figuring out if Invisalign's right for you. So ideally you want to clean your aligners just like you'd clean your teeth. Obviously you're going to take time to brush your teeth because you'll take the trays off and then brush your teeth the way you normally do. I still also recommend that people brush the insides of their trays with water and toothpaste. There are little ultrasonic, basically little vibration cleaners that people do stick their trays in. They're not really necessary if you are really particular about keeping them as absolutely as clean as possible. You can use those, but you have to remember the trays really only need to last for about a week, week and a half, and then you're going to move on to the next set. So you just basically need to do your best to try and keep them as clean as possible for about 7 days. So I think it's really important to know that when you're looking at Invisalign, Invisalign should be done on people with healthy teeth and gums. That means no cavities, no gum disease, no current lingering infection that's not treated. Like, you want to make sure that your mouth and your teeth are as healthy as possible before you start Invisalign treatment, because when you do Invisalign, it's going to make it just a little bit harder to keep your teeth clean. So you want to make sure that your teeth are as healthy as possible before you go into this treatment. You don't want to have any cavities or gum disease present before you start Invisalign treatment. Now, if you do happen to have Invisalign cavities or gum disease, it's okay, but you want to make sure that those kind of things are treated and taken care of before you start Invisalign. So I would say that's the main thing that you want to make sure of before any kind of Invisalign treatment is started. I hope we've been able to answer some of your questions about Invisalign and Invisalign treatment. If you have any other questions or if you're ready to get started, please call our office at 916-285-9678. We're here to help.